Hi, thanks so much for joining me. I'll be presenting our research on the impact of the COVID-19 pandemic on physical and mental health among caregivers of young children in the United States. My name is Kate Havens, and I want to acknowledge my co-authors, Kat Starnes and Jenny Bagwell. The perinatal period is a time of enormous change in an individual's life. And we were really interested in learning about this population and infant caring practices in the United States, as well as physical and mental health. So we created a survey in early 2019, and we published it in this journal. Little did we know, of course, that this data would serve as a really interesting control population because just about a year later, the COVID-19 pandemic created a major disruption to perinatal care. And many researchers have shown the negative impact of the pandemic on mental health. Major restrictions were imposed, and we just don't know a whole lot about the physical health of these individuals because musculoskeletal pathologies like pelvic floor muscle dysfunction and back pain often just go unaddressed and are considered a typical part of perinatal health, even though we know the physical therapy can be really helpful. So that's really one of the biggest impacts of our work was to compare not just mental health, but also physical health outcomes during the pandemic to a truly pre-pandemic time point and assess the perception of the pandemic's influence on health outcomes. And understanding these changes really helps us to identify specific areas where support and resources are needed. So we invited caregivers over 18 years old with children under 5 to participate. We recruited individuals using a survey and had them take it either in this pre-pandemic time point or during the pandemic in the fall of 2021. We had about 3,500 individuals respond to our pre-pandemic time point, about 300 in our pandemic group. About 30 couple of years old and predominantly highly educated white women is who responded to our survey. Many of them were married and about 50% had a child that was under 1 year old. Compared to the pre-pandemic group, which is shown here in blue, the pandemic group shown in purple had significantly greater disability or symptoms on all physical and mental health scores that we asked about. So here you can see this is aspect disability, so back pain, pelvic organ prolapse distress inventory, the urogenital distress inventory here, then depression score, anxiety, and perceived stress scale here. So both mental health and physical health in our pandemic group was worsened. We also asked just the pandemic group about whether their symptoms had changed over the course of the pandemic. And for back pain here, you can see about 40% reported either a moderate or significant worsening of their back pain. For pelvic health, about 30% reported a moderate or significant worsening. And about 85% of individuals reported a moderate or significant worsening of their mental health over the pandemic. And while that's pretty consistent with other researchers who have shown decreased mental health during the pandemic, we also showed that compared to the pre-pandemic group, the pandemic group had a significantly greater prevalence of participants who met the cutoff for depression based on their depression scores. So one of the most important findings of the study was this physical health piece. So worsened symptoms of back pain and pelvic health with the pandemic. We think both the reduced postpartum care might have exacerbated this, but also anxiety has been shown to be a major factor in the higher risk of reporting low back. And anxiety has been shown to be higher in individuals who have urinary incontinence. So those bothersome mental health symptoms could be related to these physical health symptoms and also maybe related to decreasing physical activity in the population as well. We also identified increased stress, depression, anxiety during the pandemic, and that may have been contributed by the fear of the virus, social isolation, disturbed healthcare services, or economic stress. Also, we identified that individuals who perceived the impact of the pandemic to be greater on their lives also had worsened mental health. So what does this mean? The results of this study show how important enhanced care and support is for this population and really encourages us to advocate for flexible perinatal health services and continuity of care. Telehealth has been shown to be effective and demonstrates adaptability in care delivery. Our results also demonstrate how vital physical therapists are in addressing physical issues like back pain and pelvic floor dysfunction with targeted intervention. And also the idea of integrating mental health screening and support within a biopsychosocial model is really important. as well as using a comprehensive approach to support caregivers throughout and beyond the pandemic. So thank you so much for listening, and take good care.